Everyone. So I just have to point out this little quote here at the bottom. It was totally perfect for me today, that almost everything will work again if you unplug it for a few minutes, including you. So I just wanted to point that one out for the week. Next slide, please. So today we're going to be taking a look at some of the issues and strategies that come up around staffing, workforce and workflow, and think about and discuss some of the strategies about how we can navigate through some of these challenges, and then also take a look at some of the ways that we can look at supporting staff, maintaining morale, self-care, and then as always just really looking to see what we can learn from each other. What's working, and where maybe we can spend a little bit more time. Next slide, please. So I thought we would start the session off by just kind of doing a quick review of the current guidance around the management of staff who have either have an infection, or if they have had an exposure, particularly a high risk exposure. And so there's been lots of change around this, and it can get very confusing, but right now in general, if you are have an asymptomatic staff person who's had a higher risk exposure, but they have had their doses and their boosters, so they're all up to date with their vaccines, and they don't have symptoms or test positive, then they can work. There's no work restrictions for them. We always want to think about the ways that we can continue to protect staff and patients and the visitors, and so that's always important. So we really want to focus on those infection control practices like good hand hygiene, using our PPE appropriately, source control, the cleaning and disinfection of the surfaces and the environment. And then when we think about those strategies, there's lots of different ways that we can address the staffing shortages. And there's guidance from the New Mexico Department of Health around this, with contingency strategies, and then crisis capacity, in the event that you are just in dire straits with your staffing. And we were just talking about this a little bit earlier, but if you do need to move to crisis capacity or crisis staffing, you do want to contact the Aging and Long-Term Care with Department of Health, just to get sort of written approval for that. They do appreciate that sometimes you don't know until you get those call-ins or you get those test results back, and they're doing the best they can to be very responsive to that. But if you are needing to move into crisis staffing, then you do need to contact them. Next slide, please. So this slide is really just the same information. It's just in a table format. It's also in the Department of Health guidance. It's under in the testing guidance that was recently released as well, but really just kind of giving you some guidance around conventional, contingency, and crisis. And what we really want to always be trying to work within is the conventional. That's sort of the gold standard. And so when it comes to things like having people and changing the work restrictions based on your staffing capacity, it's really important to recognize that that doesn't go without risk. So if you are having people come back to work early, for example, after they've tested positive, so you're using that contingency plan, for example, then you need to be aware that they may still be shedding and there's an increased risk for transmission. So they're all things that you have to kind of take into consideration, but they are tools that are there to help you. Next slide, please. And so when it comes to staffing, we know that staffing has been a challenge prior to the pandemic, but it's really been amplified. And you can see on this, on these charts on the on the slide here that that feeling that there's been huge staffing changes within the long-term care sector. If you're feeling it, it's because it's real. This is just very recent data that's come out from the American Healthcare Association. And you can see there for nursing homes that they've had a significant increase in their staffing over the last year or so, and the same has been for assisted living. So, everyone is that, these challenges are really are very real. And of course, there's new things that have come along that have not helped, like Omicron and having breakthrough cases and, staff, not coming, being able to come to work because they're testing positive. And so that's really in part why there's these contingency and crisis strategies out there. And we know that there's a number of different reasons why people are leaving. A lot of times it's been, people may have just chosen to retire. It was their time and they've chosen to take that opportunity. But for others, it's been very COVID specific. It may have been due to vaccines. It may be that they have caregiver responsibilities, either for children or parents or other family members. For some, there's been a financial incentive. Some have chosen to become travelers. And then, excuse me, others have just, have found that just the increased stress and pressure has really impacted their own health and mental health and overall well-being. And so there's a number of different reasons why the workforce has been impacted. And hopefully today we'll be able to address some of these issues. Next slide, please. So when it comes to thinking about these staffing challenges, really, how do we address some of these challenges? They're not easy. People have been working on these for quite some time. But one approach is to think about how we can work smarter and not harder. And so this is really just going to kind of highlight some of the ways that that we can look at these different scenarios. So when we think about working smarter rather than harder, often it's really looking to understand what are the tasks, what are the activities that contribute to that greatest workload burden. And a lot of times your staff are able to tell you that, or you may have observed that already. But sort of reaching out and trying to assess what those tasks are. And then you want to think about how we can really map out and improve those processes. Staff may have already figured out workarounds, and so that is one way that staff have maybe addressed some of the challenges that they're experiencing. And so trying to understand where there's opportunities to increase efficiency, and then thinking about where staff can be responsible excuse me, I have got tongue-tied today, but how staff can be responsible for performing these tasks on a regular basis, so that there's some consistency around that. But we really want to focus on how we can streamline and mentor and teach staff how to organize their work to increase efficiency. Many of the things that they are doing today, for example, around PPE, has many more steps than it did a couple of years ago. And so people may not have always been able to work those efficiencies into their normal workflow. And then we need to think about just in general how we can make some improvements to our physical environment. And there's a good resource there. Next slide, please. So when we think about looking at these different types of tasks and how to assess the workload, it's really important to do this with your team. And because usually when we have a team approach to things like this, buy-in is good. You'll get good feedback from people, good and bad, whether it's working or not, but then you're able to make some tweaks and help improve those processes. And so the first step is usually identifying the task, whatever that might be. It may be something, a new process that you're needing to implement, or it may be just looking at something that you're already doing. And there are many things that we're doing these days around COVID, or to try and, work through some of the other tasks that have maybe been sitting on the back burner. But once you've identified that task, you want to then break them into the steps. And then this slide really highlights some questions for your team to ask when you look at those different, each of those steps. Is every step needed? How many steps are there? And then thinking about, do we have all the supplies that are needed? Have we set up the physical environment so that it meets those needs in the best way possible? When we think about our work processes to avoid cross-contamination, this fall, obviously we think about PPE, but it's also how we use and store our equipment. There's lots of different times where we can be cross-contaminating, and sometimes our workflow does not support that that type of activity. And then thinking about are there other ways, or do staff have ideas? Does the team have ideas about how you can improve efficiencies? Thinking about what are people doing as workarounds now? Do people, stash supplies somewhere closer at hand because they don't want to have to walk, to the other end of the building to get something? And then thinking about how we can be more person-centered in our work. Making sure that the resident is sort of at the center, and then we have our staff, and then all the pieces as we move outwards. And then oftentimes we can think about if there's other team members that are working with us that can help and be involved in this process, that may have some good ideas, some insights that we can utilize. Next slide, please. So when we're thinking about, making changes, I think it's always important to recognize that it can be very disruptive. Some manage change better than others. And we've certainly gone through a lot of change, and I think there's almost like a fatigue to it. Like there's always a change happening, and it feels like we often go round in circles. We implement a change, then we go back to what we were doing before. But I think as a leader or a manager, it's really important to sort of take a look at those staff lists, those to-do lists that staff might have, or activities, tasks, duties, and look at what is still relevant and what is necessary, and remove them. Shorten that list if you're able to. Making sure that the changes add benefit for the end user. So really trying to understand, thinking about why we have those tasks or those steps in place, and then thinking about the value of them. Think about how you can co-develop those workflow processes. So really thinking about how you can, maybe share or create some redundancy. So maybe it's not always one person, but there's more people to be able to help with those different tasks, and maybe step in if somebody is unable to do the task for whatever reason. And it's always important to remember about those regulatory requirements. Sometimes there's steps that are not helpful, but they're there because they have to be. And a lot of times, staff, once they understand that that's a requirement, or that can't change, and that they know that, they understand the why behind that, they're usually going to be more accepting of that particular step. They understand the importance of it, and so there might be other ways that they can create efficiencies that don't impact that particular step. And then it's always important to really communicate, around the changes, setting up a process, whether it be staff meetings or a notice board, or different ways that you can share information and review those processes. Let people know what is changing and also what's staying the same. Sometimes when we have change, it gets confusing about, are we changing this step, or are we keeping this step the same? And so just making sure that that communication is really clear. Next slide, please. So when assessing a change has happened, especially when it's one that impacts workflow or the workload of someone, there's some different tools that are out there that can help you to evaluate them. This is just one example, the NASA Task Load Index. Just really wanted to show this to you and let you know that there are tools out there, and there'll be more discussion around this during the consult session next week, so just keep an eye out for that. Next slide, please. So when it comes to managing staffing, sometimes we do have to get a little creative, and usually it's easier to think about how we could maybe be more flexible, think about alternatives, if we understand clearly what our workflow actually is. And so if we're looking at a specific task, or how we can best manage different workflow, sometimes there's going to be periods where there's more activity and less activity. So things like flexible staffing hours may help, or alternate scheduling. Being able to maybe staff a little heavier during those times where you have a lot of activity, and then maybe being able to reduce that a little bit at other times during the day. Sometimes, people like to be able to have that flexibility. It can be helpful for families from a personal level, but it can also be helpful, obviously, to the organization, because you're really maximizing how your staffing can go. And then there's different ways of scheduling. And so one example is just 12-hour shifts. That might be something to think about if you've been traditionally doing 8-hour shifts, for example. Thinking about how you can utilize some of your other staff, particularly those that are non-clinical. And I know that during this past couple of years, many people who had non-clinical roles may have been, stepping up and taking on sort of more clinical roles, particularly if they have had a background or licensed as a CNA, they may have had to step into those particular roles. But think about, having a plan for how and who is going to do which activity, so that if you are in a crisis staffing position, that that, this person who works at the front desk, they're also going to be the person who is going to, make sure that people's water jugs are full. But just making sure that there's a written plan can be very helpful for the staff to know what they're supposed to do in the event that you're wanting to deploy them. And then thinking about different roles that you could hire into. So hiring personal care assistants may be an option depending on your setting, or people that are not licensed like a CNA, and then they can be taught and trained to do certain tasks and that they can perform. They may be able to help in different staffing situations. It also may give you an opportunity to introduce them to your facility, and you might identify them as being someone that you want to encourage to maybe go further and get their CNA license, or provide them with some additional training. And then when we think about family, oftentimes it's appropriate to ask if they would like to help with care. You can empower the resident and the client to perform self-care whenever they can. I think it's always important, though, to remember that you don't want to be using family as staff. They're really just there to help, supplement and aid and give an additional quality to the care that's being provided. Next slide, please. So retention. So, retention, I think, is always preferable to, having to hire on new staff and replace quality staff. You've usually put in a lot of time and effort into, training and onboarding and getting those staff, at a place where you want them. And so we know that it's from just a cost perspective, it's expensive to replace staff. Having consistent staffing improves resident care. People know the residents know the staff. There's a level of comfort and trust that can be there. But we know that there's other competition and things that are out there that can be making it harder to retain staff, that you're having to compete with some different forces, things like perhaps pay and benefits. And so thinking about different ways that you might be able to provide some incentives for staff to stay with you are things to maybe consider. And so things like maybe different benefits, tuition reimbursement are just a couple of different things that are out there. Um, people love to be told that they're doing a great job and that recognition. And so sometimes, ways that you can reward them is by having career ladders. And so this is really where you take the person's scope of practice, and you allow the staff person to sort of build their resume within that scope of care. And so if they are taking on additional responsibilities or different types of activities, then they may get compensated for that and recognized. Engaging members, leaders who are leading by example, different ways that you can engage, have awards and do different things. Making sure that staff have the equipment and the supplies to do their job and to do it well. And this means having equipment that works. Sometimes I go to facilities and there's a piece of equipment that's all taped up because it keeps falling apart. It's not good from an infection control perspective, but it's also not good from a morale perspective either. As an organization, that you care about the equipment that your staff are using. And you want to create a culture that's supportive and welcoming for staff. I think that's becoming increasingly more important, whereas people are, if they have a choice, they're not going to necessarily work somewhere where they feel that the culture is punitive or it has a very negative feeling about it. They want to be at a place where they feel supported, where people are happy. And so just some different ways that it's not always about the money. Sometimes there's other ways that you can retain staff. Next slide, please. And so this is just a different way of looking at the issue around staffing, and particularly the cost of staffing. And so this is a quote that if we raise the pay of all the nation's CNAs by $10,000 a year or $5 an hour for a full-time worker, this would have a total cost of $20 billion per year, which sounds like a lot, right? But it's less than 1% of the amount that we've spent in 6 weeks to fight COVID. And I think it really puts it in context about how much has been the cost of this pandemic. Next slide, please. So when it comes to self-care and well-being, there's been a lot more attention paid to the importance of this, and how there's a real need to support staff and also oneself during challenging times. And so I think this slide just really highlights the two sides of that coin. That staff are either preparing for work, at work, recovering from work, and so really they don't have any time really for self-care. And many of you may feel that already. Like, people talk about self-care, take 5 minutes, take 15 minutes, and you're like, where will I fit that into all of the things that I'm trying to do? But recognizing that without taking care of ourselves and taking care of each other, that we're not going to be able to do the work that we desire to do. And so it really comes down to trying to find that balance. But we're recognizing that we have to put our own oxygen masks on first before we can put the oxygen masks on others. Next slide, please. So a little bit about culture that we touched on a little earlier. but it's becoming increasingly more important. And I think especially in times when you're looking to hire staff or retain the staff that you have, really taking a critical look at the culture of the workplace. And then think, and in doing that, really look to remove the things that are unsafe or negative. Asking, what is important to you? Why do you choose to work here? What is your values? And so when we start to take a closer look at that and really think about these things, we start to the changes that we want to make. We really want to think about how can we remove some of the impediments to people's work. And so I really like those pebbles in their shoe. Those things that are they're just the everyday niggle, and perhaps it's just hasn't been brought to people's attention, or it's not considered significant enough to maybe warrant some attention. But if it's something that just is this little thing every day, becomes a much bigger problem. So thinking about the ways that you can and really improve look at the culture and this idea of joy in work, that people want to come to work. They want to feel that their work time is valuable and that they have purpose. And so ways that you can invest in your workforce is simple things, spending time in the field or on the floor with staff, letting them know that they're valued, going around and asking them how they're doing today. Is there anything that you could do to help them? Seeing if when someone is needing something, that you can go grab it for them. That's a very powerful tool. I've worked in places where, people talked about administrators and leaders never coming down to into the hospital section and being on the floor, that they really didn't have an understanding, and so they didn't sort of have that same credibility, and that staff felt that they felt valued. Practicing kindness with each other, making sure that we're communicating well, that we're doing it often. Always assume that you're not communicating enough. Doesn't necessarily mean being wordy about it. It just means making sure that you're checking in and letting people know what's going on, and that they're doing, how are people doing. And then encouraging staff to work in teams, looking at ways that, groups of people can do things, that you really have this sort of camaraderie and a team approach to the work. Next slide, please. So along these same lines, that there's a lot more research and work being done into understanding how we can improve our culture and give value and sort of increase our resiliency during this pandemic and maybe other challenging things that can come up. And so really looking at how we can put value in our teams and show that they are valued in big and small ways. Looking at how we can measure stress and burnout and recognize it amongst each other. There's a lot more focus on the physiological safety, that people can, speak openly, that they can say, I don't understand, I don't know why we're doing this. If they see that something is wrong, that they're open and feel that they are safe to be able to say that this is not okay. And by the same token, if they see things that there could be improvements with, that they're empowered to make those suggestions. It's really important to not have sort of this culture or this punitive feel where if somebody makes a mistake, it's not, mistakes are mistakes. They're not an intentional thing that's happened. A lot of times it was a process, things failed. And so where people are supported and you're looking for particular ways to stop things from like that, mistakes from happening again, is that sort of creating that safe culture. Modeling self-care. I mean, again, this really can be so important, but making sure that the leaders and the staff have the rest that they need to take care of themselves, so that they can then help their staff and make sure that they have sort of, the the gumption, the get up and go, the energy to be actually able to keep going. You know, we're in this phase that we seem to be in for a long time, and there's not sort of a light quite yet at the end of the tunnel. And so, you know, again, it's this idea of just being able to keep up that those forward momentum that we need to generate. And then thinking about, you know, ways that staff can communicate. And so there's a number of different tools and things, and a lot, as I said, a lot of work that's being done in this particular area. So I think there'll be more to come around this particular topic. Next slide, please. This is a slide that has been used in one of the earlier cycles that we did, but we thought it would be a good idea to just kind of highlight these again. It seemed to be a good time to kind of look at some of the ways to promote and model self-care. So some of the ways include a daily check-in, you know, like a reflection or a kudos board, just highlighting special little notes. Thinking about mindful breathing, you know, during the day, just taking a moment to, you know, do some yoga breathing, where you know, pair the breathing with a task, or you just, you know, breathe in, hold it for 4 seconds, breathe out, hold it for 4 seconds, take that big breath. You know, sleep is incredibly important, so making sure that people have good healthy sleep, checking in with staff, asking them what they need. Normalizing that asking for help, mental health and self-care. So if someone needs, you know, to take a few minutes, that they can ask their peers or, you know, their co-workers to say, hey, I need to just take 5 minutes and step out for a few minutes, you know, can you cover? That it's okay to ask that. It's not a weakness, it's really a strength. Providing a safe rest and break area for staff, so allowing them and providing them a place where they're able to step away. And then again, look for those opportunities where staff are able to take a 5 to 10 minute break. Maybe if they've been working a lot of extra, to be able to leave a little bit early. But making sure that, you know, these types of things are inclusive, and everybody has opportunity to participate. Next slide, please. And so I just wanted to sort of finish with you know, investing in well-being, and you know, there's a lot of different ways that you can tackle this, but it has been shown to be worth the effort. And so this is just highlighting a program that was piloted in South Carolina. They did an education program that was focused on compassion, fatigue awareness, and self-care skills. So some different strategies that people can use to help you know, take care of themselves. And then they measured sort of the retention and the success of the program. And so after 1 month, retention increased by 43%. And at the end of the 4th month, retention was 100%. And then I think this is probably the biggest indicator, was that 44% of the full-time supplemental agency staff became full-time employees with the facility, that they wanted to stay. And so I think that that's really reflective. And so this is just one example about, you know, how some of these different strategies can be deployed and can be effective. And they'll be certainly talking more about this next week during the consultation.